Okay, I'm in the right group this time. I should be live, I think. Okay, so it looks like I'm here, and it's 9 o'clock. I'm actually on time. I don't know if I can stand the strain. So, oh, wonderful, 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 and I can see whatever chat you're putting up. So anybody who wants to ask questions can ask questions now, and I'll be able to see the questions. Okay? This is the first time I'm doing this, so if I screw it up, don't be too upset, okay? It is bright and sunny and cold here in Philadelphia, Pennsylvania, which is where I'm calling you from. And this is my office. I was at home. I was going to bring my dog in so you guys could say hi to my dog, but he tends to be very loud. You know, I'm very, very happy to be here today, so I would really like to answer whatever questions you have. My practice is completely alternative medicine. Okay, my general expertise is in epigenetics and nutrigenomics, which most people think about as methylation and MTHFR. That's something I teach on a postgraduate level to other practitioners. I also teach neurology, endocrinology, and immunology. Thank you. And would be very happy to answer your questions. What I do is basically fix the body so that it can work again. Okay, it's my general type of patient that I see is people who've been here, there, and everywhere, and have been able to be properly diagnosed or properly treated. And so that's what I'm, pretty well known for. What would a slightly positive result actually... the person who asked what would a slightly positive result actually mean, ME, could you expand on the question, please? If you're talking about testing, like Lyme testing or any other kind of testing, a slightly positive result is what's called an equivocal result. Okay, now, when you look at Lyme tests, like a Western blot, thank you, what you're looking at is a computer's interpretation of the amount of immunoglobulins or antibodies that are present at certain areas, which they call bands. And those bands are really weighted bands, different weights of substances. And they're measured in kilodaltons, whatever that is. The positive result is 60% or more of what they consider the exemplar or what the example is. Equivocal would be somewhere, I'm just going to make up a number, let's say between 50 and 60. When you look at Western blots, it's important to understand that if your body's producing antibodies to Borrelia burgdorferi, or Burgdorferi, sorry if I'm pronouncing it wrong and trying to get it completely right for England, that it's not so much which bands are positive, it's a matter of looking at all the bands and seeing how much immunoglobulins you're producing. So a lot of times I'll read I'm sorry, I'm a terrible multitasker, so I'm reading questions as I'm answering the other question. When you have a slightly positive result and you see several of them, which is the problem with reading some other Western blots, which is why I use a particular lab, because I can see them. You look at the preponderance of evidence. So a slightly positive result in the presence of appropriate symptomatology would be considered a positive test. Remember, Lyme disease and other diseases are not diagnosed on testing. They're diagnosed clinically. Okay, the testing helps and sometimes hurts because sometimes it's negative when it shouldn't be. But testing is not there to make a diagnosis. It's there to confirm a diagnosis or rule out certain things. And unfortunately, many doctors today will make their diagnosis via testing. One question is, what general advice would you give regards to diet, lifestyle, and supplements for those suspecting Lyme who may not have been diagnosed and or can't afford to get expert help? Well, if you're suspecting Lyme, okay, I'm going to tell you one thing that's absolute. If your index of suspicion of Lyme disease is quite high, it's one of those things that's not going to go away. Okay, so you have to treat it. It'll hide for a while, okay, and about twice a year it'll come out to replicate, and you'll start getting sicker and sicker and sicker as time goes on. And because Lyme is a spirochete, it will go for the neurological system preferentially. Okay, so there is stuff you need to do that you have to kill it. You have to get it. Okay, sometimes the testing. Sometimes there are doctors out there who will treat based on symptomatology. I often treat empirically. Okay, and I'm sorry if I'm going to miss some of these questions because they're coming fast and it's going up a list, and I often can't see them when they pass by, so I'll try and make sure that I catch everybody. Okay, so what general advice? Usually the order of treatment is to reduce stress, fix the cells, fix the gut, balance the neurotransmitters, and kill the bugs. Okay, now fixing the cells and fixing the gut is usually primary, so it's usually a little bit of dietary advice. So if you don't know what to do, the general recommendations of no gluten, no casein, stuff like that. Okay, and fixing a gut is rather simple. I don't know why everybody has such difficulties with it, but it's the use of digested enzymes, something to help the cells heal, something with a phospholipid like sunflower lecithin or liposomal phospholipids, colostrum, something to help the mucus layer be recreated, like slippery elm and so forth. Okay, and a good probiotic. Those are things that will help your body reset the gut. Okay, which is the major reason for inflammation. The things that your body needs to work. Okay, cofactors and coenzymes, vitamins and minerals. You need a really, really, really good source of vitamins and minerals. Okay, that's absorbable, so that your body simply will work. Okay, that gets into a whole mess of different types of difficulties. Like which products you use and so forth and so on. So, but if you're looking for general treatment, that's a good way of generally treating it. Again, oh great, I can move this up and down. Wonderful. Okay, what would I recommend for afternoon fatigue? Well, of course, you have to look at the root cause of the afternoon fatigue. It could be anything from hypoglycemia to thyroid disease, adrenal related. Usually thyroid is like you're tired all the time. Adrenal can be usually afternoon. It could be mitochondrial also. So it's not a matter of what I would recommend. It's a matter of finding out the root cause. It's best to adjust gut function before starting herbal protocols, or both, or start herbal and see if it helps. The person asking that question is asking a very good question. Okay, it's a decision I need to face on a daily basis. Do you do the gut first or the dysbiosis first or whatever? That's also a clinical decision. Okay, and I'll tell you where my triage in my head goes. Okay, if somebody's very, very, very ill, okay, and I don't think clinically that they could handle any kind of, I'm going to call it bug killing protocol. Okay, just to use a generalized term. Because of the toxins that will be released from that, I'll work on their gut first and their general health, and see if I can't get them feeling a bit better. Okay, so whatever I tend to do, in the other realm, or whatever any other doctor's doing, will be able to handle well. And frankly, some people, they're so filled with whatever they're fighting that sometimes you have to go after that first or simultaneously. Again, it's a clinical decision. And it's all a matter of how well you feel at the time, okay? Is Borrelia actually the problem, or does other imbalances cause the dormant Borrelia to be active? Which way round is it? I'm sure lots of people have Borrelia in their system but cope with it. Well, really, really good question. Remember that our bodies were made to fight infection. Okay, once Borrelia or Babesia or Bartonella or any of the tick-borne diseases kind of take root, okay, they can cause the imbalances, and then the imbalances causes them to be able to continue to express themselves. Let me use a different example. Think about herpes simplex type 1. You call it a fever sore, right? Herpes tends to stay in the body and the covering of the nerves. Why do we call that a fever sore if it's there all the time? Well, when you're under stress or you have a fever, okay, that's when it tends to express itself because the immune system's off doing something else. Okay? Excuse me. So, the trick is that you've got to treat the root cause and downstream effect. I'm sorry, this camera's really small, so I'm Italian. I want to start talking with my hands. So, sorry, it's just the way I am. Okay, you have to treat both ends, and that, frankly, that's what I end up telling other doctors to do. To not follow protocols is to start looking at the person as a whole and looking at the root causes and looking at the downstream effects and looking at what those root causes did, and then make decisions on the order of treatment. So you actually have to do both. You have to treat both, and the fact is that when infection takes root and your immune system's all fighting it, spies can come in. Okay, in other words, if you're fighting Lyme disease, things like parasites that you would normally fight off, things like viruses that you would normally fight off, things like bacteria or yeast that you would normally fight off, you can't. And then it becomes a big vortex, one, another, and then your immune system, just simply can't fight everything. This is why rotating antibiotics oftentimes doesn't work, or rotating antimicrobials. There's a study called the cell danger response that was done by Robert Navarro at the Metabolic and Mitochondrial Disease Centers, University of Southern California, that pointed out, and scientifically, that all the homeostatic mechanisms, those things that make you heal, okay, when you have one problem, that's not an issue. Okay, you just, you use those homeostatic mechanisms and you heal. But when you have one thing after another, the damage or the interference with those mechanisms that allow you to heal synergize and get to the point where they don't work anymore. And this is why the common wisdom of Lyme can't be cured, I consider to be complete nonsense. Okay, and the reason I consider it to be complete nonsense is because of that cell danger response. So if you get the body working again, the immune system will take care of certain things. Just think about it. If you had strep throat as a kid and the doctor gave you an antibiotic, you didn't kill all the beta hemolytic strep. You just got it down to the point that the body could take care of the rest of it, right? Okay, but if your body doesn't have that ability and you have bacterial, viral, parasitic, and fungal infections, well, you're going to take an antibiotic, and you're going to take it to a certain point. Okay, then you're going to take an antiparasitic, and while you're doing that, the bacteria are growing again. Then you're going to take an antifungal, in which case, you stop the antiparasitic, and then the parasites are going to grow, and then the fungi are going to come down. And it becomes this horrible vortex, and every time this happens, you're weakening your body. So the approach has to be holistic, if you will. It has to be both areas. So that's a really, really good question. Let me see here. Having any bands on Western blot, having a serological antibodies presence and documentation that you had exposure to Lyme. Well, it depends on who you talk to. Okay, the 41 band, which is representative of the tail of the spirochete, they tell me can be almost anything, any kind of spirochete. Remember, Borrelia bugdifori is not the only Borrelia out there. Okay, there's Borrelia abzelli, Borrelia strictus sensu, Borrelia. Oh, by the way, Texas, here in the United States, has its own strain, Borrelia lone starry, the Lone Star State. They even have their own tick. And I won't even tell you the story about that because I don't have time. Okay, but you also have various other types of spirochetal illnesses, rheumatic spotted fever, yada yada yada, that can be representative of some kind of spirochetal. I'm sorry, some kind of spirochete. So is having one band representative of Lyme? Again, it depends on who you talk to, and remember that Lyme disease, always are clinical diagnoses. Okay, they're not to be done on testing. Okay, I can't tell you the amount of people who have Lyme disease who have totally negative testing. Okay, you can't depend on the testing. You have to depend on the history. Okay, and believe me when I tell you, it's like using a crowbar to get doctors to start learning how to do a history again and following what the history says and treating people in that manner. How important is the CD57? Again, it depends on who you talk to. When I do a CD57 and it's low, it tells me that the immune system is overcommitted. Okay, it's an army that is overcommitted. Okay, so that's how I use the CD57. It's a pretty good, it's a pretty good idea to give me an idea that somebody's fighting something. And it may not be Lyme; it could be many other things. But when you have the vast majority of my patients, if you would see them, you'd say they're not sick, okay? And I bet many of you guys who are who are suffering from chronic illness look perfectly okay, okay? And that's the real problem, isn't it? Okay, nobody believes you. Okay, but so when you have a test that you can look and say, oh, like you see, the immune system is having a problem. Okay, that's kind of worth its weight in gold because I know you're ill, you know you're ill. But when the other doctors don't see anything on their testing because the testing is God and it shouldn't be, and then your family's being told consistently that it's in your head, after a while, even though your family loves you, they're like, well, it must be, and then they're going to diagnose you with ME or CFS or depression, which seems to be the big the big diagnosis in UK especially. Can you relapse from Lyme? Absolutely, you can relapse from Lyme. Okay. I also have reactivated EBV, not that my GP will accept it, but I keep having recurring problems with Lyme, apparently because we have no deer tick. Well, let me address the fact that you don't have deer ticks carrying stuff in Buckinghamshire. Sorry if I've mispronounced it. First of all, Lyme disease is all around the world. Okay? Those maps that you see for the concentrations of Lyme are CDC positive cases. Okay, that doesn't mean all the Lyme. That's not the Lyme disease that's there. It's much worse than that. Okay, it's very hard to have a totally CDC, Center for Disease Control positive test. Okay? Lyme disease is everywhere. Okay, we have a global economy, people flying back and forth. To give you an example, they found Lyme disease in the emperor penguin in Antarctica. Okay? And the seabirds carry the ticks over. Okay? So that's one point. So Lyme disease is everywhere. All right, so let's not even get into it. The other point is we haven't really worked out all the transmission vectors. Okay? So we know that it's transmitted by ticks, but there's also evidence of transmitting it through the placental barrier while a baby's in utero. There's also evidence of sexual transmission. There's also evidence of transmission through breast milk. So, and I think that a lot of this stuff is being suppressed. One of the stories that I always tell my patients is, you guys may also know that I was a registered nurse for 10 years before becoming a doctor. And when I was a nurse, I worked in A&E. And that was in the late 1970s. And during that time, AIDS was just coming to the forefront, and we're becoming knowledgeable about it. In the medical literature of the time, the only way to catch AIDS was if you were a homosexual and were from Haiti. Seriously, in the medical literature, that's what they said. So we found out differently that it can be transmitted, right? Okay, it can be transmitted a whole mess of different ways. I think we're that way with Lyme right now. And because you can be ill with Lyme or ill with EBV or ill with anything else, one can cause the other to reactivate. Okay, it's because your body's weakening and your immune system can't do what it's supposed to do. Okay, Epstein-Barr virus is not the bugaboo that everybody thinks it is. Okay, it's just another virus, and it can get reactivated if you're not, if you're unwell. Okay, and if you're unwell, it may not even be completely apparent, but it's there, and then it's an accumulative effect. Okay, and think about having a leaky gut syndrome or having trace mineral deficiency, so your biochemical processes can't work. You notice I'm not even talking genetics right now, I'm just talking about plain old physiology. Okay, and then you're not able to have your immune system work, and therefore other things can take root and express themselves. Daughter has completed 6 months pulsed antibiotic, ticks, and hydrochloroquine treatment. Hydroxychloroquine treatment looks and feels better, but symptoms have come back. The usual reason for that is because they're treating the bug and not treating the body. Okay, often the contribution that I have with most of my patients is I'll see that they have been treated very well by antibiotics, and let's just use antimicrobials just as a general term. Okay, and often it's helped an awful lot, but the doctors, because of the way they're trained, and it's not their fault, it's because of the way they're trained, they don't treat the body. They treat the microbe with the assumption that the body will take care of itself. Now, that's not exactly true, and that's where that cell danger response paper really pointed out, where if you had one event, usually no problem. But when you have several events, multiple things happening at once, and usually Lyme is not by itself. Usually what's happening with it is pretty nasty. You use up your body's abilities to counterbalance or to balance itself again to achieve homeostasis. And that sets up a situation where some of the symptoms will return simply based on the fact that you can't heal. By the way, since we're on the subject, okay, not all symptoms of Lyme disease that you get after you've been treated are actually Lyme disease, okay? Now that everybody's fallen and fainted at that statement, let me explain to you why. It's called a facilitated neurological pathway. When you're ill, whether it's migraines or this or that, okay, migraines are a really good example. It's a cascade effect. In other words, what happens is you develop a pathway that creates certain symptoms. And if you were talking about migraine, it would be a pathway that creates a migraine. Okay, and once that pathway is created and utilized a lot, it's like creating a rut in the ground. And even if you stop the going back and forth of whatever you use to create the rut like a wheelbarrow, that rut's going to remain. And when you have a certain amount of dysfunction, the energy, however you want to put it, it's going to go along that particular pathway and give you the same symptoms. So very often people who believe that they have a recurrence of Lyme disease aren't actually having a recurrence of Lyme disease. They're just becoming ill and they're getting the same symptomatology. Okay, that's why it gets a little crazy with the testing. Okay, and why you have to take a history, why you have to fix not only the microbial illness but the body itself. Okay, it only seems to make sense. Is there any association with thick mucus phlegm and Lyme? Well, directly, no. But yes, in the fact that, you're creating, when you're killing off stuff, you're usually creating an awful lot of toxins. A lot of that toxins could be, histaminic. And if you have a lot of histamine, you're going to produce a lot of phlegm. And if you're not hydrated and you're ill with other stuff, that phlegm can get very tenacious and get very hard to get rid of it. There you go. Okay. Sorry about that. Sorry about that. It's hard for me to do this. I have to do it on my phone. It doesn't work on computer for whatever chicken reason. My grandson, age 3 years, some is according to 2. What do I do about it? Vertical transmission to both grandchildren from mother. I look at my grandchild. Okay. The question here is, what do you do about parasites of blood? Okay. I'm glad that you can. What do I do about it? Vertical transmission from both grandchildren from mother. I look at my grandchildren every day wondering what to do. NHS is not acknowledging anything. Well, no offense, but the NHS not acknowledging something is not exactly what I call unheard of, okay, shall we say. Okay, listen, I'm very glad you brought this question up because it brings up a very big point. Parasites of whatever ilk, okay, parasites are the most underdiagnosed and undiagnosed illnesses in the world today. When I'm in England, and I'll be there in about 3 days, for another month to take care of people and teach practitioners, when I'm doing my live blood cell analysis, I can't tell you the amount of parasites that I catch. Okay, and much more in England than anywhere else, I think because they're ignored. Okay, I can actually see them on the film. I can see worms. I can see intracellular parasites. Parasites are so inimical to the body that the reaction is amazing. Okay, parasites are the reason for autism. One of the reasons for autism. Okay, that creates an incredible amount of dopamine that will give you autistic symptoms. It will cause innumerable amounts of illness. Brain parasites, and I've caught a lot of these, will make a child almost look like they're possessed. And let me tell you a little secret. One of the ways you can tell if somebody has got parasites, aside from the fact that you might see it in the stool and so forth, which is that's another story altogether, is if their symptoms get worse at the full moon. I know that Lyme can do that also, but if their symptoms are at a certain length, and you've ruled out Lyme disease, or that they're at a certain intensity, and they're getting worse at the full moon, it's probably parasites. Okay, and the worst case I ever saw was a kid who, if I had permission, I could show you the video. He looked possessed, and he would get worse. He would exacerbate the full moon, new moon, and the quarters. Okay, that was amazing. And I have another young lady right now who I'm very convinced has brain parasites, and she's 11, and she's exhibiting almost sociopathic behavior, self-injurious behavior, desire to hurt other people and stuff like that. It's a horrible thing. Okay, so what do you do about it? Well, here's where, again, clinical decision-making has to be done. There are medical or pharmaceutical antiparasitics. There are natural antiparasitics like artemisinin and MMS and stuff like that. Okay, you have to work with a practitioner who is learned in treating this, and it has to be done, kind of aggressively. Kerry Rivera in Lyme world, I think Keri Rivera has a protocol that she uses with autistic children. Okay, I meant to say in the MMS world, I didn't say it. Hopefully I said that. Okay, it seems she has the highest degree of recovered autistics that I've ever seen. And essentially what she's doing is killing parasites. She starts using these substances, and in the kids you see the parasites dropping out of the butt. Why don't you see parasites on stool tests? Because the parasites are holding on to the inside of the colon. They're holding on to the gastrointestinal tract, and you have to kill them to see them drop out. And they say, oh, you don't see the ova either. Well, guess what? Trying to see ova in a stool sample is, let's put it this way, finding a needle in the haystack would be easier. Okay? Again, it's done on history, and there are certain things you see on lab tests and so forth that will tell you that parasites, like if the eosinophils are very, very high, okay, here the eosinophils should be like, I'm going to make up a number from 25 to 500, and if they're over 500, well, nothing else is wrong. You better be thinking parasites. Okay, so you have to work with a practitioner either in UK or elsewhere that is not only learned in doing this, but is willing to work with parasites. It's a tough thing. It really is. It's tough because you need to find somebody to do it. Okay, somebody to recognize it. Okay, but when you do recognize it and you do treat it, the healing, the changeover is miraculous. I've seen kids and adults just turn around, and mind you, it's not fun treatment because these things are pretty nasty. Okay, and you can get them anywhere. Okay, you don't have to be a sushi aficionado. You don't have to have traveled to Thailand. Okay, you can get them anywhere. And if you have a family, children, mom, dad, let's face it, they're going to pass it around. Okay, just like they pass around a virus, pass around anything else, they're going to pass around parasites. Okay, so nobody should be embarrassed about that. If one person in the family has it, then you should treat the whole family. Okay, I'm sorry I can't be more specific than that, but that's the best guidance I can give at the moment. I'm on hydrocortisone and propranolol, struggling to tolerate supplements and worried about how unwell I am, bedbound and deconditioned and getting worse. How can I this is a good question. How can you stabilize yourself without tolerating supplements? I've been faced with that particular problem with many of my patients in UK and here in the United States. And I love my UK patients, by the way. You guys are the best. Okay, every time I come over, you guys welcome me like I swear. I feel better going there than than coming home sometimes. Anyway, working with either transdermal. Okay, there are some patches now that I've been using myself, and Sean Bean has been using with his patients, and I've been using with some of my patients. We're getting good results with them. Transdermal can also be taking baths, with substances in the baths. Liposomal products, things like, I shouldn't name particular products, but things that are liposomal is a way to get stuff into your body right through the tissues. But most people, when they swallow it, that's when they really have the problem, because what you're talking about is more of a contact problem when you get to the GI tract. So with anything's, hitting the GI tract, you get sick right away. But you can take liposomal forms of vitamins and minerals and phospholipids and so forth and swish them around your mouth for about 2 minutes and spit it out, and you're going to absorb about 80% of it. Okay? Sublingual. Okay? Some products that are liposomal that look something like this. Okay, I'm not going to name the company. Okay? You can do 1 or 2 pumps, and 1 or 2 pumps is like 1 cc. And you just let it sit, it'll just absorb. Okay, and of course intravenous or by injection. Okay, and I realize that intravenous is not often available to you, but things like the Myers cocktail, I've used that in my office also, because we have a medical physician that works with us, and what we did was take Myers cocktail and expanded it, and our Gardasil girls who were injured by the HPV vaccine and who had mitochondrial dysfunction, we were able to turn them around. It took a little while, but we took a bedbound patient and got them up and walking, and I can show you pictures of our young ladies who were previously completely knackered and couldn't get up at all, and now they're just living life. So this takes a creativity, okay? And I agree that you're starting to get worse, but that's where I would go with the supplements. Again, if you need to work with a practitioner who knows about this stuff, there are several, and these substances like the patches and so forth are very available. You just have to know where to get them. Abnormal brainstem activations. I'm sorry, that's a really generalized question. I don't know that I can answer that in this, without a little bit more specific. A little bit more specificity. I'm sorry. Is it vital to have your amalgams removed if someone's financially challenged? Would the priority be affording the herb supplements or to address the fillings first? Thank you for asking that question. Okay, excellent question. Okay, here's the thing about amalgams. Okay, we know that they're mercury. Okay, we know that every time you go, okay, and your mercury fillings hit, you create a little spark. Okay, that releases a little bit of mercury. Here's my contention. If your detoxification pathways are working, okay, and you can get them to work a lot easier, that little bit of mercury can be metabolized out. One of the homeostatic mechanisms I talked about before is called metal homeostasis. So lots of times when I'm looking at someone's heavy metals, and I look at a pattern, they have thallium, they have this, and you say, my God, what do they do? They live in next to a nuclear power plant? No, it's coming from the air. Okay, it's coming from the tailpipes of cars. Okay, it's what's being pumped into the air, and it's getting into your cells because you're breathing in several liters of air a day. It's getting into your cells and you can't get rid of it. Okay, so the primary thing to do there was to get rid of it. Okay, so unless you've had an acute mercury exposure or an acute heavy metal exposure, doing chelation generally makes you worse. Okay, and unless you pump a ton, and I do mean a ton, of trace minerals in with it. Okay, so is it vital to have the amalgams removed? No. In my opinion, don't anybody faint, don't anybody come after me. I'm Sicilian. If you come after me, hey, things can happen. You know what I'm saying? Tings. But if you remove the amalgams, even if you go to the best biological dentist in the world, you're going to take a mercury hit. Okay? You're going to get this big bolus of mercury in your system, which I think is going to make you even worse. Now, I'm not talking about fillings that are falling out and cracking and infections and stuff. I'm just talking about the general concept. Okay, there's many permutations of this particular argument. So whether you're financially challenged or not, okay, it wouldn't be my first priority. Okay, my first priority would be getting my body working. Okay, so that I could conjugate out or metabolize out the heavy metals. Okay, and frankly, it would be kind of last on my list. Okay, because when you're very, very healthy and you want to get those amalgams out, okay, it's got to be done correctly, and a good biological dentist will tell you, and it's hellishly expensive. Okay, so if a dentist just goes in and starts drilling out the amalgam and replaces it with something else, you're going to get this enormous amount of mercury, which is only going to get to your mitochondria and make things much, 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 much worse. Okay, so in answer to your question, I wouldn't worry about the amalgams. I would concentrate more on getting my body working first. Okay, however you're going to go about it, the herb supplements. There's just we can do an entire 2 or 3 hours on how to fix and get your body working again. Okay, it's kind of my thing. That's what I do. Okay, I would love to talk about it at length. As you can tell, I love to talk. Okay, but that's just me. Anyway, but that's what I would do, and I realize there are many, many people out there that would disagree with me vehemently. Okay, and frankly, I will disagree with them vehemently. Okay, I've been a healthcare practitioner for 41 years. Okay, I've seen a lot of stuff come down the pike. All right, and this whole concentration on removing amalgams as a primary mode of treatment, you only hear about some of the people who did well. You don't hear about the vast majority who did horribly. If your CD57 is normal and you're positive ITT Elispot, okay. The Elispot is a test called MELISA, Memory Cell Lymphocyte Immunostimulation Assay. Okay, it comes from Scandinavia, and it started first with testing heavy metals or metals for metal allergies when they didn't believe that you could be allergic to metals. Okay, what it does is take your white blood cells, okay, and it cultures them out for a few days. Then they put antigens in there for whatever you're testing for, okay, and it could be Borrelia bulgarifolia, it could be EBV. I know Armin does a very good job with the Elispots. I wish I could get my patients tested there from the U.S. because his level of Elispots are just not available here. Okay, and then they let it culture out for a few more days, and they look at it, and they see the response of the T cells. If there's this massive response, okay, it's scaled. 0, 1, and 2 is considered okay, 2 is considered positive, above 2 is, and it depends. But I've seen 75, I've seen 350. Okay, now what does that mean? Okay, it means that you have T cells that are specific for the antigen involved. And the more response you get, the more T cells you have. Does that mean that you have this massive infection, you've had multiple infections, or you've had the same thing for a long time and twice a year it starts replicating, so every time it replicates the immune system sees it, okay, it starts producing more T cells? Okay, that's where history comes in. So if your CD57 is normal but you have a positive Elispot, and let's say the positive is really positive, not 2, okay, which could be, not so much, but let's say it's 20, okay, well you're really sure that it's positive. Then what's happening is you have Lyme that is quiescent. Okay, you have the T cells to it, okay, but it's quiescent. Now, if you've killed it all, and you're sure of that, okay, which the CD57 might indicate, you might be just, making the T cells respond. The T cells don't go away for about 10 years. So if in your history, points out, and this is why history is so important, that you properly diagnosed, you took care of everything, and the bug is gone, okay, and your CD57 went from very low to normal, but you have a positive Elispot, okay, my conclusion there would be you got it all, and these T cells are just sitting there, and they will sit there for about 10 years, and if I put antigens in, they're going to respond, okay. If my CD57 is kind of normal, I've never been treated for Lyme at all, okay, but I was treated for other things, and the Lyme is quiescent, I'll have a positive Elispot. But if there was no treatment for Lyme, I would say that now the Lyme is sitting there waiting to rear its ugly head. You have to make decisions based on history. So you see the different scenarios you could have with this particular thing. Okay, one is you treated everything, you got it all done, it was low, it's now high, but you have a positive Elispot, and that would tell you that you've just got T cells that are going to sit there and wait. And two, the CD57 is normal, but the Elispot is high, and you've never been treated for whatever the Elispot tested for, okay, which means it's sitting there waiting for you. It'll get you, okay? But you need to know history, okay? If you don't, you're not going to get this right. What is the typical recovery time for CFF after using Protovite? Protovite does not cure chronic fatigue syndrome. Protovite, which is a multivitamin, multimineral, multi-phytonutrient liposomal product that's in a phospholipid, it also has liposomal phospholipids, provides the body with what it needs to work. So when I talked about getting vitamins, minerals, cofactors, coenzymes, and so forth, okay, into the body, okay, that's one of the better ways of doing it. There's also products by Quicksilver Scientific and so forth that are very similar. Using just Protovite, if the problem was just that your body needed the vitamins and minerals and so forth, you'd recover very quickly. I can't tell you I've run into that too many times. Okay, there's usually, remember that most chronic illnesses are multifactorial. Okay, you have to consider that. So, whereas the Protovite or something similar will give your body what it needs, okay, remember that it's not just that. There's balancing of the neurotransmitters, there's balancing of the neural hormones, there's balancing of the thyroid hormones, there's balancing of the sex hormones, okay, and then there's, getting after whatever the root cause is, usually not one root cause, root causes are. And it makes it very difficult, okay, and very, very complex. Okay, my world is complex multifactorial, that's what I do, okay. Protovite is a tool. Okay, it's not an end unto itself. I like the tool. Okay, I think it takes, what we had to jump through the gut and so forth and kind of passes through that. Okay, but in and of itself, okay, it's not curative. Okay, it's one of the better things out there in my estimation that can get stuff into your cells and heal your cells, but in and of itself is not curative. It's a tool. So there's multiple factors that have to be considered. Okay? Any tips on controlling anger? I understand somewhat to do with Babesia. Again, an excellent question, and I appreciate you asking it. Okay? Anger is excitation of the neurological system. Okay? Often when people talk with me, I talk excitation, inhibition, and they're like, why do you talk like that? Because we'll talk about anxiety, we'll talk about anger, we'll talk about OCD, we'll talk about ODD, oppositional defiance disorder, we'll talk about this, that, and the other thing. And all of these things have a stigma attached to them. And again, any symptom can have a load of different causes. Okay? Is anger specific with Bartter Babesia? Well, yes and no. It's specific for chronic illnesses that cause dysfunction in the body, that cause you not to have enough inhibition to counterbalance excitation. In the neurological system, in the neurotransmitter system, you have this balance between inhibitory and excitatory neurotransmitters. And if you can see the chart behind me, which is of my own creation, okay, it's called Brain Wall. Okay, which explains all this. It's beautiful, and my son, who has schizophrenia, who's doing very well, and I love him, and he's my hero. Okay, when I created this, he digitalized it, and it tells you what parts of the brain, which neurotransmitters are involved, what symptoms, high, low. It's really rather cool as a teaching tool. Anyway, so anger or excitation can be caused by what's bugging you. Okay, but more than that, it's caused by the chronicity of the problem, and you have so much excitation that what you use to calm that down, okay, you don't have that much anymore. Things like serotonin, GABA, glycine. GABA is gamma-aminobutyric acid, which is that green thing you're seeing up here. Okay, GABA. Okay, GABA is what the mammalian brain uses to calm itself. If you don't have enough of it, because either you don't have enough substrate, okay, or the enzymes are not working, or you simply have been overusing it, and your genetic predispositions are towards a certain type of expression, That's what you're going to express. So some people with too much excitation expresses anger. Some people express as anxiety or nervousness. Some people express with OCD or ritualistic behavior. Some people express with depression. Okay, I've seen a lot of excitation with depression. Even Parkinson's, is supposed to be very low dopamine. Well, I've seen Parkinson's with high and low dopamine. Okay, it's all a matter of balance. Okay, so in controlling anger, what can you do? Okay, well, the safest thing to do without, hurting anybody is to use GABA. And frankly, there's in UK right now, the only thing you can get your hands on is liposomal GABA, and that's sold by Quicksilver Scientific, okay? And that has GABA and L-theanine, which will raise GABA in the brain and also lower glutamate. Glutamate is something that's very, very injurious to the body also. But it's not an answer, okay? Remember, that is a hell of a Band-Aid, but not an answer. Okay, let me make that clear. By the way, there is no dishonor in using a Band-Aid as long as you keep looking for the bleeding and trying to stop the bleeding. The dishonor occurs when all you do is use a Band-Aid. And how many times have people been giving medicines, especially neuropsychiatric stuff, where it's basically a Band-Aid. All right, it'll raise a certain neurotransmitter for a while, but they never address why that particular neurotransmitter is low. Let's think of an SSRI like Prozac or Lexapro. Okay, they never address why it's low. So that medicine's doomed to fail after a while, isn't it? Okay, because it doesn't matter how much a serotonin reuptake inhibitor reuptakes. As my mother would say from Brooklyn, if you ain't got it, you ain't got it. So if you don't have serotonin, it's not going to work. Okay, so the safest thing you can do right now is to supply the individual with some GABA, and the liposomal GABA does get directly into the brain. Okay, and it's usually quite safe. And anything else. Remember that all mental illness of whatever ilk is physiologic. Okay, that's why most of the therapy fails, because they never address the physiology. If you don't address the physiology, it doesn't matter how much talk therapy, how much CBT, cognitive behavioral therapy, or anything else you do, it will be temporary, okay, until you fix the physiology. Okay, so guess what? Anger is a tough one. Okay, because usually the person you're dealing with doesn't want to deal with you. They're pretty angry. Okay, but if you can use the GABA and you get them a little calmed down, then you can start addressing the root cause, which is what I suggest you do. And again, that can be, hellishly multifactorial, and you should work with a practitioner that understands what to do, okay, and how to go about it. And dealing with neuroendoimmunology, because I got into this because of my son's mental illness, and it burgeoned over the past 15 years. Okay, this is something that even in the circles that I travel in, okay, when it comes to neuropsychiatric things, they refer it all to me because I understand it better than most people. Okay, and I have a more holistic view of treating it. I'm not trying to blow my own horn. It's just something I'm very passionate about. Okay, and something that I do fairly well with. Totally agree with the HIV parallel. Thank you so much. I try and make parallels and stories that allow people to understand things. Guys, I have 6 degrees, and does it really matter? No. It matters that I understand stuff and I can explain it, so you understand it. Okay. Even other doctors, I explain things to them in larger terms so that they can see the pathway and see how things work. Okay, before. You're not going to be impressed that I can pronounce polysyllabic words. Okay, you're not going to be impressed that I know all the biochemical pathways and I can name them. What hopefully I can do for anybody is make them understand what is wrong in a manner that they can understand. Because you know what that does? It takes away fear. Our biggest enemy right now? Fear. Okay, you take away fear, you can handle whatever you got. Okay, because then, as Madame Curie always said, okay, nothing in life should be feared, but merely understood. Okay, when you understand it and you're not afraid of it, you take away its power. You want to get rid of a bully? Smack him in the nose. Okay, you want to get somebody's going to come after you and you just look at them like this, like you're not afraid. They look at you and say, I don't know. Okay, but we need to get rid of fear. Okay, and one of the best ways for me to do that is to empower my clients, my patients, anybody that I teach, anytime I'm yammering like crazy if you listen to my podcasts, I want you to understand. The more you understand, the less fear there is, the more you will heal. Thank you for saying that. How does one treat ammonia gases manufactured by bugs that will affect the central nervous system? Okay. Again, if I take this question as it's written, how do I treat ammonia gases manufactured by bugs that will affect central nervous system, taking away oxygen, therefore migraines, muscle contractions, muscle contractions and organ issues? Well, by the way you said it, okay, tells me how to fix it. Okay, we've got a lot of bugs doing this. Okay, we have to get the body, working again, get the gut working again, and so forth. And ammonia, okay, which is usually a pressure, if you will, on the transsulfuration pathway, okay, which will raise the amount of nitrogen, and you get a lot of ammonia in the system. There's three amino acids that are important in the arginine pathway. Okay, it's arginine, ornithine, and citrulline are usually needed, aside from a bunch of cofactors, to conjugate ammonia into urea. What that gets conjugated into is nitrous oxide through the INOS pathway, which is used for bug killing, by the way. Okay, and then through the ENOS pathway, nitrous oxide is used for vasodilation. Okay, which is controlling blood pressure and so forth. So, killing the bugs. Okay, so reducing stress, getting the cells and gut and gastrointestinal system working, because that's where a ton of inflammation and dysfunction comes from, and fixing the cells means getting vitamins and minerals and so forth into the cells so the biochemical pathways will work. Okay, and in this case, either providing arginine, ornithine, and citrulline, which are kind of safe to use. I mean, even if you didn't have testing, you could go ahead and use them without too much of a problem. Okay, and see if the ammonia does in fact come down, or the brain fog that you suspect is from ammonia. Okay, and then killing the bugs. So if you go about it the opposite way, by the way, if somebody has all these symptoms and you start killing the bugs first, well, you're going to get those symptoms really worse. So again, it's a clinical decision. But in answer to treating ammonia, it's usually either arginine, ornithine, and citrulline, or a combination of them. I've used them all together with good success without hurting anybody. And remember that not everybody responds to everything the same way. Okay, which is why you should trial things. In other words, whatever you do it in a trial. You just don't take it for months and months and months on end. Okay, you do a certain trial, see how you feel. Then I always start low and slow. When I took training with Defeat Autism Now, which is now MAPS, okay, because I'm also a Dan doctor, one of the phrases I always remembered was go low. Low and slow is the way to go. Okay, and I'll do that with anybody, because let's face it, all right, if you've been ill for years, what's the rush? Let's go low and slow and work our way up one thing at a time. Okay, otherwise, if you just throw a bunch of stuff at you and you get sick, you're going to have to stop everything anyway and start one at a time anyway. So that's the way I would approach this. I realize I'm being a little bit more general in my commentary because, not knowing an entire case and not having an entire case history, all I can offer you is generalities. What are your thoughts on the Cowden protocol? Okay, again, very good question. How is Lyme treated? Okay, I'm going to give you the quick overview. All right, medically, it's treated with antibiotics. Intravenous could be rotating antibiotics, antifungals, antiparasitics. Okay, basically medications done either orally, intravenously, whole, different ways of going about it. If you look at Gen 6 protocol or anybody, you can see how complex it can get. Too, in the alternative medicine world, okay, you have herbal protocols, Cowden, Byron White, there's a whole mess of them. Those are basically answers to the medicines. Okay, so Cowden, good protocol, works, okay, but you have to do the foundational work, working with the body also. Same thing with the medicines. If you don't do that, you're going to get the same results, okay, where you've killed the bugs, but you're still sick, all right? In the middle of that, okay, so Cowden works as long as you're doing it correctly, as long as you're doing it in concert with doing what I call foundational or bioterrain work, if you will, okay? In other words, working on getting the body fixed working itself. And when do you use the herbal, and when do you fix everything else first? Well, there you go. You have to figure that out. It's a clinical decision. In the middle ground is what I like to call broad biocidal approaches. Things like artemisian, things like biocidin, things like colloidal silver, things like MMS or chlorine dioxide, okay, which tend to go after all the pathogens without killing the body. Okay, again, you have to do foundational work with that. And then on the other side, there's the bioresonance machines, things like Rife and coiling and stuff like that. And let me tell you something, they work just as well. Okay, I wish there were a dipstick or something like they use with the cars, where they could just plug in this computer and tells you what's wrong or tells you what works. Okay, but there really isn't. Okay, so what I've noticed with the bioresonance machines is that if somebody's really, really spiritual, okay, if somebody's really they respond well to the gentler techniques, the more energy techniques like Reiki and stuff like that. They do well with the bioresonance machines, okay, because they work, like I said, just as well. They work on electrical principles, okay, and anybody who doesn't understand that, think of the opera singer that can sing a certain note and break a crystal glass, okay. Dr. Rife, when he worked out these frequencies, basically he's putting a frequency into the body, and certain microbes, because of their structure, go poof, okay? So it actually does work. So Cowden works. Almost everything works, but it's got to be done correctly for the right person at the right time. And that's where the real challenge is. Okay, and love Patch MD. So do I. That's where I get the Patch MDs, where the patches, the transdermal patches come from. Okay. Oh, we've got about 3 minutes left. I have a breathing problem alongside other symptoms. In your experience, is breathing difficulty a symptom of Lyme? Also, can this get better? Yes, I've seen specifically Lyme and some of the co-infections cause breathing difficulties. Is killing the Lyme or whatever it is going to be the answer to it? Probably. Okay, as long as the breathing difficulties, if that's the only root cause of it. Okay, lots of times breathing difficulties have multiple causes. Okay, especially if you're a smoker. So again, it's one of those things that you have to work with a practitioner who's learned it in going about this, because sometimes killing off the bugs can make the breathing problem worse, because you're talking about response to toxicity. Okay, or to the specific toxins that a particular bug is putting out, that you may be putting a lot of histamine response, a lot of IgE allergies. Okay, so this one I'd be a little bit more careful with, because just going after the bugs may make you worse before better. So that's my opinion on that. How does one get rid of this 24/7 derealization? That is a wonderful question. Okay, derealization is something called depersonalization. Okay, that's when you feel like you're outside your body. Okay, kind of a common thing for me. I'm sorry, I don't mean to be. I don't mean to make fun of it. Derealization is very serious. Okay, because it makes you feel horrible. Okay, it is a severe neurotransmitter imbalance, but it is very, very, very treatable. Okay, the reason I can't say what to do, like, hey, take this, is because, frankly, there are many imbalances within the neurotransmitter system that can cause this depersonalization feeling. Okay, but I will say that if you don't treat it, or you don't get somebody who knows what they're treated, it can progress. Okay, and here's how you know where it's going to go. In the epigenetic world, when I can read all those fancy tests. Okay, and while some people go along, why do some people respond one way than the other, even though they have the same path? Like, you get two different people, and you're looking at a set of polymorphisms. Like, why is one acting this way, one acting the other? Well, really, we know the pathways. We don't know all of them. Okay, we don't know their specific interactions, because the specific interactions are very focused on one. Focused for that individual. So what I do is I will ask a person, who the person who's having the problems, who do they look like in the family? Let's say they look like Grandma Gail, okay? And then I'll ask, well, how is Grandma Gail's health? Okay? And let's say Grandma Gail had schizophrenia, okay? Well, if you're having derealization and you look like Grandma Gail, that's kind of where it's heading. So it is, I'm glad we're doing this for an hour because I just got a message that my battery's about to give out. Okay, sorry. It's something that needs to be treated. Okay, it's something that has to be treated rather. This is where you do want to do testing, neurotransmitter testing, and if you have in your family people who've had this kind of problem and worse, that's a hint that you might head in that direction. Okay, so I wish I could tell you take this and it'll go away, but it's finding out why that's really tough. Do I think CBD oil is useful? I'm finding that it helps. Yeah, I agree. CBD is cannabidiol. Okay, it's one of the most healing parts of the marijuana plant, and it's non-psychoactive. Okay, it works very, very, very well. Okay. It is a little past 10 o'clock, and unfortunately, I have to go. Okay. I hope I answered a lot of your questions. Okay. You guys see me on Facebook. You'll see me on LDUK. Feel free to throw more questions at me. I'll do my best to answer them as best I can. Okay. I'd like to be invited back at some point to do something like this again. I realize it was a little screwy doing it this way. Okay. But it seems to work very well. And it saves me from a lot of typing because I'm not a very good typist. Okay. And I can answer questions more specifically. Okay, so I thank you for having me. I thank you for letting me be part of your lives. Okay, I'll be in UK starting Thursday, and I'll be there for a month. I'm looking forward to working with your practitioners and working with the patients that have, set up to work with me. So I am very, very, very honored to be here. So I bid you a good day. Have a good day now. Take care.